choosing solutions. It's not always easy. Why? Well, a person doesn't drink the same amount every day. They don't pee the same amount every day either. That's why it's important every day to make an assessment and base your solution choice on the information you have today. Before making solution choices, you need to do a patient assessment. Take their blood pressure, weight, and check for swelling. Have this information ready before calling HDU. Let's review our solution choices. There are usually 3 bags that you have to choose from. One is the red bag that goes on the heater bag. The other one is a supply bag. And the third one, if the patient has a last fill, is usually extraneal. Extraneal goes on the blue clamp and it's a doctor's order, so that bag is easy to choose. 1.5%, that's going to remove either 0 or up to 200 milliliters of fluid. And if you use 1.5%, don't be surprised if you have a negative UF. That would be used for patients that are under their goal or blood pressure is low. 2.5% dianeal bags are going to remove either 200 up to 400 milliliters of fluid. 4.25%, also known as the super sucker, is going to remove 400 milliliters or more of fluid. We only use that if a patient is very volume overloaded. Before making the decision to use a 4.25, you should call HDU to review the patient's assessment. Now let's review your patient's assessment. If their blood pressure is low or normal, if they're under their goal or they're at their goal, and if there's no swelling, then it's an easy choice. You use 2 bags of 1.5% dianeal. If your blood pressure is normal, your patient is over their goal, and their swelling is small amount, then you can do a bit of a mix-up. You can use the 2.5% on the heater bag and the 1.5% on your supply bag. It means you don't need to be very aggressive. You just need to remove a small amount of fluid, a little bit more on that night. Now, if the blood pressure is a bit high, your patient is over their goal, and they have a moderate amount of swelling, then you need to be a bit more aggressive and use 2 2.5s. One on heater and one on the supply bag. Now, if your patient is not doing very well because their blood pressure is very high, they're over their goal by a lot, over 2 kilos, they have moderate to large amount of swelling, then you should use the 4.25. But again, call HDU before making that decision. When it comes to solution choices, you cannot harm a patient in one day. You can harm them in a week. So it's very, very important that every day you look at the solution choices that were made the day before, and did you get the results you wanted? Are you going towards a normal blood pressure, a weight that is what the doctor's order, and no swelling?